Very good evening to one and all. I welcome you all today's Oration program. Uh, this is today we are celebrating Happy Doctors Day also. So I wish you all a happy Doctors Day. With us today, our orator is none other than Dr. Mala Srivastava, whom we all know. She is the chair for the academic wing and renowned oncosurgeon and robotic surgeon from Gangaram Hospital, New Delhi, which is a premier hospital. And today we have with us Dr. Lagveer Dhaliwal Madam from Chandigarh. And we all know that she is one of our guiding force. And we are really idolizing her since we are a student. And Dr. Pushpa Daya, she is the head of department PGIMS Rohtak. And Dr. Leena Sridhar, who is heading the state chapter of Delhi as a chairperson. So I invite Dr. Mala to start her oration and introduce her formally. Any of chairperson you can. Yeah.
Good afternoon,
Somehow
everyone.
my connection was bad.
So now I invite Dr. Mala Shirvaswa, as Dr. Ragni has already introduced her. She doesn't need any introduction. We all know about her. And she's going to say about the role of doctors in the age of artificial intelligence today. She's a known robotic surgeon, so I think none other than can tell us very rightfully about the role of AI, which is there in our life. Thank you. Now, Dr. Mala Shirvasa, please start your talk.
Thanks, madam, for your kind introduction. And first of all, I must thank Dr. Ragini, madam, for giving me this opportunity. We are going to talk today evening regarding role of doctors in the age of AI. From stethoscope to superintelligence, the human touch still matters. The question is not whether AI will replace doctors. The question is whether doctors will redefine themselves alongside artificial intelligence. Did you know the medical knowledge doubles every few months? Clinicians face information overload. Burnout is globally seen. AI can process millions of data points in seconds. We are not facing an AI revolution. We are living through it. So, what is AI in medicine? The digital revolution in healthcare, artificial intelligence, electronic health records, big data analytics, telemedicine, wearable health devices, virtual and augmented reality. Healthcare is undergoing a transformation comparable to previous medical revolutions. What is the evolution of healthcare and where is the journey of medicine? We had an era of observation. Our senior people used to just observe and then give the diagnosis and do the treatment. Then came era of diagnostics. Then came the era of evidence-based medicine, era of digital health. Now there is era of artificial intelligence. Every major advancement changed medicine, but none as rapidly as artificial intelligence. We are clinicians. The greatest transformation in medicine, 18th century stethoscope, 19th century X-ray, 1940s antibiotics, 1970s ultrasound, 2000 genomics, and today artificial intelligence. So what is AI? AI includes machine learning, deep learning, natural language processing, predictive analytics, generative AI. AI does not think like humans. It learns from what humans have already done. So machine learning in healthcare analytics, there is smart health records. There is drug discovery and manufacturing, disease identification and diagnosis, disease prediction, personalized medicine, and personalized treatment. So AI is already here. Everyday examples: radiology interpretation, ECG analysis, pathology screening, clinical documentation, virtual assistants, drug discovery. The future is not coming. It has already arrived. So changing healthcare landscape. That's what they say. Historically, doctors were supposed to be the source of knowledge. Today, patient, internet, artificial intelligence. Now the patient is active healthcare consumer. New reality. Patients increasingly arrive with online medical information, AI generated opinions, specific diagnostic expectation, suggested treatment plans. Why this topic matters? Because from information scarcity to information abundance. Then doctors searched for information, used to go to the library and then read the books. Now doctor filters information. Tomorrow, doctor will validate AI generated information. The physician of the future will not be judged by what they know, but by how wisely they use the knowledge. So what AI does best? AI strengths are pattern recognition, big data analysis, speed, consistency, continuous monitoring. And what is human strength? Empathy, trust building, ethical judgment, communication, contextual understanding. Patients as technology consumers. There's evolution of patient empowerment. There's internet era, search engines, medical websites, social media. AI era, GPT models, medical chatbots, symptom checkers, personalized recommendation. Patients as technology consumers, they benefit. Yes, they benefit because now better informed patient. They are greater engagement with their complaints, their symptoms, and their treatment. Patient understands and participates in decision making. But what are the risks? Misinformation, unrealistic expectation. So the question is, will AI replace doctors? Common fear is AI systems can analyze huge data sets, recognize pattern rapidly, reduce diagnostic errors, work continuously without fatigue. But the reality is AI changes the roles of doctor, it does not eliminate it. The core values of medicine still remains human. So ethical challenge 1, informed consent. Can patients truly consent? Problem: patient may rely on AI generated information that is incomplete, incorrect, contextually inappropriate. Impact is distorted understanding, reduced autonomy, poor healthcare decisions. Ethical challenge 2, bias. AI learning learns from historical data. If training lacks diversity, AI may perform poorly in minority population, rare disease, underrepresented groups. AI may not be able to diagnose rare conditions. Consequences: health inequity, diagnostic inaccuracies, reinforcement of disparity. Ethical challenge 3, the black box problem. Why did AI reach that conclusion? Because many AI systems cannot fully explain decision pathways, weighting of variables, reasonable process. Challenges are transparency, accountability, and trust. So you see, there are 3 things: human expertise, patient preferences, and AI insights. Human expertise is clinical knowledge and experience, context and nuance, critical thinking, ethical judgment, empathy, and compassion. Patient preference, values and goals, personal circumstances, cultural background, risk tolerance, informed choices. AI insights, large scale data analysis, pattern recognition, risk prediction, evidence based suggestion, and decision support. Working together, what matters most: the right care, right person, right time. So when the 3 are integrated, there's better understanding and communication, better decisions, better care, better outcome. There is augmented clinical decision making, and there's also personalized and relevant recommendation. Doctor Who analogy: regeneration, not replacement. The article compares physician to the fictional character, the doctor. Every generation adapts, evolves, learns new skill, yet remain true to compassion, service, humanity. Yes, medicine is entering its next regeneration. What AI does better than humans? AI strengths are speed, pattern recognition, big data analysis, continuous learning, and automation. AI never gets tired or distracted or overwhelmed. AI but has hallucination. When AI gets it wrong, AI hallucination, generation of false or misleading information presented confidently. For example, incorrect diagnosis presented confidently, fabricated reference presented confidently, wrong treatment advice presented confidently. So, potential consequences: delayed treatment, patient anxiety, harmful decisions. So, AI hallucination, how do we do it? You write, I have fatigue, joint pain, and a rash on my face. What could this be causing? Based on your symptoms, now AI will reply, you may have SLE. Recommended next steps: start prednisolone 40 milligram, take HCQs 200 milligram twice daily, avoid sunlight exposure, follow up in 2 weeks. Note, this is a confirmed diagnosis. So there can be incorrect diagnosis that doesn't match your condition, made up studies or references that does not exist, unsafe or inappropriate treatment advice. Again, the potential consequences: delayed or incurrent treatment, increased anxiety and stress, potential for real harm. Talk to your doctor. Your health is too important to rely on AI alone. Remember, AI can assist, but it is not a substitute for human expertise. So, what humans can do better? They have empathy, compassion, ethics, contextual judgment, shared decision making. Patients remember how you made them feel, not how fast you interpreted an algorithm. AI will not replace doctors. Instead, AI plus doctor is better than AI alone. Doctor plus AI is better than doctor alone. AI will not replace doctors, but doctors using AI may replace doctors who don't. So we also have an AI powered hospital ecosystem. HI system in our hospital, Gangaram, was introduced way back in 2008 with a unique ID to each and every patient who got admitted. And since then, whenever a patient comes, even the patient doesn't come with their papers or the records or the hospital reports, anything, we can retrieve those data by the unique ID system. Even if the patient doesn't have the ID system with them, with their phone numbers, we can track them. So this is the AI-powered hospital ecosystem, which gets smarter care, better outcomes, healthier futures. So there is also AI-enabled diagnosis, medical imaging analysis, early disease detection, decision supports for clinicians, smart patient monitoring. There are wearable devices, continuous remote monitoring, AI alerts for early intervention, AI-powered operations, predictive scheduling, resource optimization, smart bed management, supply chain intelligence. Then clinical decision support, evidence-based recommendation, risk prediction, personalized treatment plans, virtual care and telehealth, virtual consultation, remote specialist access, AI chatbots for patient support. And of course, patient's experience can be personalized, appointment reminders, feedback, and engagement. So patients, wearables, home devices, hospital systems, labs and pharmacy, insurance and payers. It's good for everyone. Better outcome, lower cost, improved efficiency, happier patient, and healthier communities. But still, history taking still matters because AI needs good data. Garbage in, garbage out. Doctor remains essential for understanding symptoms, interpreting patient narratives, clarifying vague complaints, identifying hidden concerns. Patients often reveal important information only when the trust develops. They will say, I have not wanted to tell anybody, but. So, AI powered triage, future emergency care. AI may continuously monitor patients, analyze wearable data, predict deterioration, trigger emergency responses. Advantages can be faster intervention, better prioritization, and dynamic risk scoring. Now, the new doctor will have future roles of clinical decision making, data interpreter, patient advocate, technology evaluator, healthcare leader. Tomorrow's doctor will speak two languages, medicine and data. So, evolution of the doctor, Doctor 1, healer, Doctor 2, scientist, Doctor 3, evidence based practitioner, Doctor 4, digital physician, and Doctor 5, AI augmented clinician. Doctor will always be a team leader. In emergency medicine, future physicians will become team leader, decision coordinators, knowledge managers, and communicators. Human responsibilities by explaining uncertainty, discussing risk, guiding families, making sense of AI outputs. Only doctors can handle complexity. AI manages routine cases, common infection, minor illness, protocol driven conditions. But doctor focuses on rare diseases, complex cases, multiple illnesses, diagnostic uncertainty. So future shift may be less routine work, more meaningful work. The human side of a complexity. Patients who need more than algorithms, dementia, learning disabilities, addiction, social deprivation, mental health challenges. Because doctors matter more in healthcare decisions involving values, relationship, context, but not merely data. Of course, AI in diagnostic because it helps breast cancer to diagnose breast cancer, diabetic retinopathy, skin cancer, lung nodules, cardiac abnormalities. AI sees pixels, doctors see patients. AI in women's health applications, cervical cancer screening, mammography interpretation, IVF optimization. They will tell you which embryo is better, which is grade A embryo, which is grade B embryo, which is grade C embryo. Fetal monitoring in obstetric practice, preeclampsia prediction, risk stratification. Precision medicine begins with precision prediction. Of course, AI in surgery, robotic surgery with enhanced precision, better visualization, reduced complication, improved training. Surgeons' hand remains essential. The technology simply extends their reach. Robots do not replace surgeons. They amplify surgical capabilities. This is the OR of the robotic room. A woman's health is her capital. She is multitasker, and we, as gynecologists, are custodian of her health from womb to tomb. Our hospitals, our workplace is our temple of God. And we know we are surgeons beyond OT. We have to be knowledgeable, skilled, honest, sincere, reflective, humble surgeons and clinicians. Hardworking as well. Our patients come to us with great trust. Every knot that we take, every suture that we tie, each and every decision that we take in the operating room, there lies the trust, the faith, and the hope of the patient who's lying under the drapes. We cannot simply ignore those emotions, and AI can never achieve this. Remember, skills can be taught, but clinical judgment are earned. Integrity, honesty, hard work, sincerity, truthfulness are our true signature and ornament as a surgeon, as a clinician, and we wear it with pride. Let us all be excellent, be ethical, be kind, which AI cannot do. The future is still in our hands. AI and medical education, future learning, virtual patients. We need simulation-based training. We need personalized learning. We need real-time feedback. Doctors will learn throughout life, and AI will help them learn faster. Challenges will be there. Algorithm bias, data privacy, accountability, hallucination, overdependence. Just because AI gives an answer doesn't mean it gives us the right answer. Human touch will always be desired. What patient wants, they want to be heard, to be understood, to be reassured, to be cared for. AI may analyze symptoms, but only humans can understand suffering. Leadership in AI era. Doctors must guide innovation, define ethical boundaries, ensure patient safety, and shape healthcare policies. If doctors do not lead artificial intelligence, others will lead medicine. Why AI is relevant to gynecological oncology? Because oncology generates massive data, radiology images, histopathology slides, genomic sequencing, electronic health records, and clinical trial data, and definitely follow up for minimum 20 years. AI helps them by faster analysis, pattern recognition, predictive modeling, clinical decision support. Across the gynecological oncology journey, supports every step of patient care. Screening and early detection, for example, HPV screening, pap smear analysis, risk prediction model. Diagnosis, colposcopy AI, imaging analysis, digital pathology. Staging, MRI, CT interpretation, tumor segmentation, radionomics. Treatment planning, precision medicine, genomic analysis, precision oncology, response prediction. Treatment, we have to plan, robotic surgery, radiation planning, chemotherapy selection. Outcome prediction, survival models, recurrence risk, toxicity prediction. Follow-up and survivorship. Recurrence detection, remote monitoring, quality of life support. So AI enhances but does not replace human expertise. Early detection, accuracy, personalized care, improved efficiency, better outcome. AI in cervical cancer screening, current challenges, shortage of expert cytopathologists, human fatigue, variable interpretation. AI application, this automated pap smear interpretation, HPV risk prediction, automated image assessment, population screening optimization. Of course, the impact is higher sensitivity, faster reporting, reduced workload. And this is AI-powered digital cytology. Sample collection workflow, digital slide scanning, AI analysis, cell detection, abnormality classification, risk scoring, result and report, then it is reviewed by the cytopathologist. So there is higher accuracy, faster turnaround, reduced workload, better outcome. AI digital slides in pap smear, they can see the percentage of normal cells, abnormal cells, and then give the result accordingly. AI-assisted colposcopy, traditionally dependent on operator experience. Now, AI-assisted colposcopy detects abnormal vascular patterns, identifies high-grade lesions, improves biopsy site selection. Studies show sensitivity approaching expert colposcopy. AI in ovarian cancer detection, and it is most needed because ovarian cancer is diagnosed at advanced stage, symptoms are non-specific. So AI application, ultrasound interpretation, MRI analysis, CA125 integration, and risk stratification algorithm. Potential benefit, earlier detection of malignancy. Radionomics, a new agent biomarker. What is radionomics? Extraction of hundreds of quantitative features from imaging studies. AI uses radionomics to predict malignancy, assess tumor heterogeneity, estimate treatment response, predict recurrence. Clinical value, moving beyond what the human eye can see. Skills every doctor needs. Future competencies. Digital literacy, data interpretation, critical thinking, communication, adaptability, ethical reasoning. From black box to glass box. Ethical AI. Healthcare algorithms must be transparent, explainable, accountable, and fair. The physician's responsibility. Ensure technology serves patients, not corporations. AI and end-of-life care. The hardest decision. Should treatment continue? AI can estimate survival. Of course, there are risks of outcomes, but cannot determine meaning, dignity, personal values. Why human touch remains essential. End of life decisions involve quality of life, family dynamics, personal beliefs, individual goals. Critical principle: some decision must always belong to patients and their physicians, not algorithm. Medical education must change. Future curriculum should include AI literacy, data interpretation, ethics of AI, human centered communication, shared decision making. Why? Because the next generation will practice in an AI enabled healthcare system. Future opportunities: AI as a healthcare access tool, potential applications, remote triage, virtual consultation support, rural healthcare access, resource optimization, and early disease detection. Vision 2035, the future clinic, which will be AI assisted diagnostics, personalized treatment, continuous monitoring, predictive healthcare. Medicine will move from treating disease to predicting disease. Future of gynecology. AI will help predict obstetric complications, personalize fertility treatment, improve cancer detection, optimize surgical planning, but gynecologists will always remain central. Final message: three principles. Adopt AI, use it. Audit AI, question it. Humanize AI, lead it. Future doctor, not the one who competes with AI, but the one who combines compassion, wisdom, technology to serve humanity better than ever before. Artificial intelligence needs human intelligence. Healthcare needs humanity. Algorithm can predict diseases, but only human can understand suffering. AI enhances intelligence, but humanity delivers care. Thank you for your patient listening.
Thank you so much, Dr. Mala ma'am. That was wonderful. AI cannot be replacing us. It can always be assisting us. So I would take a comment from my chairpersons, Dr. Manju Verma ma'am, Professor Manju ma'am. Ma'am, your comments, please.
Good afternoon, everyone, and congratulate Mala for giving us in such a detail and trying to say that yes, human touch cannot be replaced by anything, whatever you do. Because what I say is that if a symptom is analyzed by the AI, right? If a person complains of cough, suppose there are 100 causes of cough, right? So the AI cannot just by the documentation find out what can be. When we see a human being in front of us, there are so many things. When I was a student, my teacher used to say, the moment the patient enters the chamber, the way the person is walking, the person's, the overlook of a person gives you a hint, and then you go on clarifying on trying to find out after he complains and all the examination is being done, that the diagnosis can be made. So it is the human touch that makes a lot of difference. Of course, AI will definitely make us meet more perfection, as near to perfection as possible. And there are certain things, investigation part, yes, it gives quite 99.9% accuracy, right? So which human brain may not be able to do it. So there are certain areas where the AI is important, no doubt, but it cannot replace the doctors. That is all I want to say. The doctors are there as a human being, and they cannot be replaced. Thank you, and wishing you all a happy Doctors' Day.
Thank you so much, ma'am. Over to our second chairperson, Dr. Lakhveer, ma'am. Ma'am, your comments on how do you feel? Would AI be supporting us? Would it be dictating us? Would it be helping us? How do you see AI coming into gynec practice?
Definitely, so far we are ignorant about AI, uh, that is no excuse. We have to learn it. We both combined AI and our own medical knowledge, medical touch, the compassion combined can do wonders for the patient. So definitely AI has a role, and we have seen in so many areas the way it is data analysis. I remember the way we used to do the obstetric analysis. So many that can be done in minutes now. So quickly it can be done. And similarly in imaging, it's doing very good job. But of course, we should not be 100% dependent on this. We have to use our own judgment definitely. Even by doing surgery also, it is our command. It means everything should be in the surgeon's hand and the head. And we can make use of AI, definitely. That is there. We now the era is that we cannot say that I do not know. We have to learn it. All of us have to learn where to make good use of AI. And Dr. Mala, very good. So beautifully you have given the lecture telling all the uses and some abuses also, which we all should know where it can abuse also the patient and the doctor both. So thank you very much. I wish everyone a happy Doctor's Day and wish everyone a safe, efficient, evidence-based and compassionate care to our patients.
Thank you, ma'am.
Very good
Thank
topic
you.
you chose. Very good topic.
And over to Dr. Pushpa Daya, ma'am, our another chairperson. Dr. Pushpa, ma'am, your comments on this
Thank you so
particular.
much, Dr. Jyoti. First of all, let me congratulate Dr. Mala. The way the other chairperson said, wonderful topic, very nicely explained the use. As we know that now the patients, they have become the active healthcare consumers. So we have to be very careful. But AI definitely, there are so many benefits are there, but still it cannot be replaced by the empathy, compassion, the ethics, which are being shared by the doctors. The moment a doctor touches the patient, so many her problems are relieved, which a AI cannot do. So definitely there is a role of AI in the screening, in infertility, in IVF treatment, oncology, colposcopy, etc., etc. But still the human touch cannot be replaced. AI can enhance, but it does not replace the human expertise or the touch. Very nicely explained. I am really overwhelmed with your lecture, Dr. Mala. Thank you so much.
Thank you, ma'am. Thank you, Dr. Pushpa. And last but not the least, our chairperson, Dr. Leena. So, ma'am, what do you have to, what are your comments on this?
Yeah. Thank you, Dr. Jyoti. First and foremost, I think Dr. Mala gave such a wonderful presentation. I think, as usual, it was so clear to the point, and I think this was really wonderful on a beautiful day like the Doctor's Day to have a topic like this. So my huge compliments to Dr. Mala's presentation. A few things I just wanted to say, and which I think she summarized so beautifully, that if doctors do not lead AI, then others will lead medicine. So we are learning throughout our lives. We are every day adding skills to whatever we know. Every day it's a surprise. Sometimes you find, oh, this thing has happened. Oh, this can also happen. So we are learning throughout life, and AI will help us learn it faster. I think that line which you gave in your presentation is such beautifully, it summarizes everything, that we are going to have a tool which is going to help us become better doctors in the future. So we must learn to embrace it. At the same time, the other aspect that where AI is going to be, leading us, no, never. There is no doubt that skills can be taught, but clinical judgments are always earned. And if you have taken us that much time to, earn the kind of, the clinical skills that we have, I think that will always only get enhanced as time goes on. And what you said about hand holding, patients need to be heard, understood, counseled, reassured, cared for, pre, post-op. I think there is no way AI is going to. But yes, we are going to see a lot of hiccups in the future where a patient will come with the AI, thing saying, देखो AI तो ये बता रहा है, but आप तो ये कह रहे हैं. So, especially in your specialty of oncology, I think it will be a wonderful tool where you can, put in all the ultrasound, X-ray, all the tumor markers, and you can come to a idea about it. And another area which I felt AI was really going to be helpful is the end of life, what you mentioned, because there's still so much of end of life to decide that, okay, a patient is there in the ICU, what is going to be the prognosis? It's very difficult. So I think there are going to be lots of wonderful things which are going to come up with AI. So let's wait and watch, and let's be part of this upcoming thing. And maybe next year, next Doctor's Day, you would have something more to say on that. So it's a wonderful presentation, and thank you very much, Dr. Mala. It was lovely hearing you.
Thank you, ma'am. Thank you, Dr. Leena. And finally, I would again go back to our president, Dr. Ragini, ma'am, and take her, because the topic that she chooses always gives us, she has some idea why she chooses that. So I would like to take ma'am comment again for the same talk, ma'am. Over to you, Ragini.
Thank you so much, Jyoti. Wonderful, Dr. Mala. Maja aa gaya. My comment is only two. One, we are going to get benefit by AI a lot, but we have to treat them as an assistant, not the master. We are the leaders. They will help me like a subordinate, and no doubt the way they AI can take out the references, everything, and we cannot do. It will take lots and lots of time. Recently, a patient came in the OPD and said, "Doctor, I'm having a prolapse. I have come to you for that problem, but I'm wondering why the prolapse has developed suddenly to me." I said, "अच्छा, कहाँ से?" जी मुझे चैट जीपीटी ने बताया है. Okay. On examination, she is having an anterolateral wall vaginal cyst, which is quite big. And with every pressure, it is coming out. So things has absolutely changed. She said, then why ChatGPT has told me this? Madam, you are a human being. You should go to a human doctor, not a AI doctor. But the thing is that it is going to be in a big way. And they are doing wonders for us also, but we have to take the lead. That is my take only.
So that was amazing. I think, Mala ma'am, you have given us a lot of insight into what
we can have a comment from Dr. Ashla Batra also. She is the senior VP. Senior VP, Dr. Ashla Batra. We can have a comment from her also. Professor Ashla Batra.
Hi, good evening. Good evening. Yeah, I think Mala's talk was very good, but we have to know that it is a tool. It should not take over us. Like we see movies, robots taking over the human beings. So it's like that. We have to use it as a tool. It has to be our servant, and we should not be the servant of AI. That's the way we have to use it. Very nice talk, Mala.
Very true, ma'am. Very true. So it is like the car that can be driven, but the driver is us. So we know how to drive it. So basically, whether we go rash or which route we have to take, how we have to how we have to treat. I think everything has to be monitored and guided and done by us. And it is only the tool that can help us, aid us, give us a lot of insights, can help in managing. But I think final verdict is the human being who is using it. So it cannot overrule us. It has to be assisting us, I suppose.
So this
So-
is an automatic car, no, Dr. Jyoti?
These days gear वाला तो भूल गए ना अभी
तो वही है, जैसे गियर हम पहले कर रहे थे, अब with AI it will become an automatic car.
Yes.
But still we are driving it.
Yes, the driver has to be us only. But it has made our life easier. The way the
Absolutely.
automatic car has made.
Absolutely.
So thank you each one of you on joining on this this very important day, and a day which all of us really cherish and we all love, because this is our day today. It is our day where we feel proud that we are doctors, and this is a day where everybody talks of compassion in the doctor, their unwavering commitment, their tireless dedication, and everybody really praises us. So that is one day where we can feel happy about ourselves. And there's a small WhatsApp message that I'll just read and then we'll stop it. Doctor is not a profession, it is a responsibility, a great responsibility of saving a life, a noble value that provides priceless service. Money can get you anything, but only a doctor can save your life. Doctors are not just people with a white coat and a stetho around neck. Doctor is a passion, doctor is a responsibility, and doctor is the last hope of life. So, a happy Doctor's Day to all, and thank you, each one. Thank you for being here today on this wonderful day. Thank you, ma'am. Thank you, Ragini.
Thank you. Thank you.
Looking forward to meet you all at Chandigarh.
Yes.
So
Absolutely.
take an idea forward.
Sure, ma'am. Sure.
Okay, bye bye.
Thank you so
Bye
much.
bye.
Bye
Okay,
bye.
माला आपकी जैकेट नहीं पता चली आज कौन से कलर की है
Red.
खड़े होकर दिखाओ जरा
राजरी है कुछ pinkish red है.
and it is matching your dress
Yes,
देखिए
that always matches.
Oh.
She is like सुषमा स्वराज, जो सुषमा स्वराज मैडम बिना जैकेट के नहीं आती थी, तो ऐसे ही डॉक्टर माला मैम तो मतलब she will always be there with a jacket. So yes.
All
Wonderful.
colors. She has all colors jacket. Always matching with her dress.
So additional, like we are fed up ना कि साड़ी पहननी है, blouse, petticoat,
मैं ये
साड़ी
सोच
पे
रही
बहुत
हूँ.
लगाना. Additional point is Dr. Mala is going to get a coat the same color. So
तो
she
माला को
will
तो
have
डबल क्लोजेट्स
first.
रखने पड़ते होंगे, साड़ी का एक और एक जैकेट्स का.
Thank you, everybody.
Okay.
Very
Okay.
nice to
Thank you very much.
Roshan
Bye.
ji,
See you.
Roshan ji, हम बंद कर सकते हैं. We can stop the recording. Thank you, everybody.
रोशन जी वेरी गुड जॉब यू डू बहुत बढ़िया हमेशा अच्छे से चलता है सब कुछ बढ़िया होता है
Thank you, madam. Thank you, madam, for this appreciation. He'll be very happy person.
really it's admirable every time I've seen so far never there is any hitch in the program in the voice in the recording the time everything very well done very responsible person डॉक्टर रागनी चुन चुन के लोगों को ना सिलेक्ट करती हैं चुन चुन के ढूंढती हैं
बंद कर लो अक्षिता.
Okay, ma'am. Okay.